Patient has developed midline swelling, midline neck swelling. What could be the possible causes of midline neck swelling? Which diagnoses a thyroid nodule most likely damaged during fine needle aspiration? And thyroid nodule. Which artery may be damaged in FNAC, that is superior thyroid artery, because it is related with the superior poles of the thyroid gland. That's why these are more susceptible to be damaged. Patient is having rhinosinusitis, nasal polyp on the fungus invading lamina papyrgia, excessive endothelial damage, and fungus that is non-septate hyphae organism is involved in it. What is diagnosis for this condition? What is causative agent? It is mucor. Next one is a when intracranial pressure is raised, systemic blood pressure is also raised to help maintain blood pressure. Which response is involved? It is answer is Cushing reflex is involved in this condition. Next one is a female patient present with weakness on the right side. CT scan shows posterior frontal parietal lobe and medial temporal lobe affected. Which artery is involved? That is middle cerebral artery is involved in the patient. Next one is a patient was asked to grip the card between tip of the index finger and thumb. The nerve involved in the checking this test is that is anterior atrocious nerve in thumb grip. Okay, so thumb gripping involved anterior atrocious nerve, a motor nerve that is branch of median nerve, and the proximal forearm deep pronator muscle teres muscles are involved in the anterior atrocious muscle. So as you can see, there is a difference. We will be looking at detailed anatomy of the hand and nerves involved in this condition. Next one is a 30-year-old woman patient was given zero point 0.1 gram of insulin on her later plasma insulin concentration 1 by 100 ml. Which of the following is extracellular fluid resistant? It is calculation method. And next one is a patient present with a decreased heart rate on ER standing his pulse increase due to decrease in venous return. When we stand up, venous return decreases, which has to compensate it by the heart. That's why increase in pulse occurs. A patient after taking analgesic overdose, having hyperventilation, tachycardia, metabolic acidosis. Most likely drug involved in these conditions is that is acetyl salicylic toxicity results into these type of the condition. Which of the following drug causes thrombocytopenia, decreased platelet thrombocytes? It is quinine. Quinine medicines can cause thrombocytopenia. Next one is, as you can see, heparin is the greatest in among all, but in option there is no mention heparin, quinine, thiazide, diabetes. A patient is present with the signs and the symptoms of aspirin toxicity. To reduce the symptoms, bicarbonate was infused. What is mechanism by which bicarbonate reduce the toxicity in aspirin? That is, reduce absorption of the aspirin. An HIV patient present with fever, neck rigidity, meningeal irritation, holocene around organism involved, that is holocene around the brain, which is likely organism, that is Cryptococcus neoformans. In HIV patients, most commonly this organ involved, Cryptococcus neoformans. Okay, so as you can see here, Cryptococcus neoformans is an encapsulated bacteriomycetes yeast belonging to the class of Trilomycetes. It is an obligate aerobic that can live in both animals and humans as well. So this bacteria and HIV can cause these kind of some symptoms and complications. Okay, so the next question is, a patient has internal jugular lymph node biopsy on the neck region that he developed a numbness in the ear lobule. Which of the following nerve got injured in this condition? Which nerve? That is great auricular nerve supply earlobe. It is injured in the condition. A child has papules rash starting behind the ear spread to the body, which is indicative of measles. RNA paramyxovirus is caused by the measles, in which rashes, papule, and behind the ear. These type of rashes starts measles, mumps, rubella. These are the viruses. There is no edema due to increase in aldosterone because of escape increased sodium potassium activity in the thick ascending liver level sodium retention. A female patient with a dry eye, mouth dysphagia, bilateral parotid swelling, X-ray shows pneumonitis. What is likely condition? X-ray shows pneumonitis. It is condition known as it is known as primary systemic sclerosis. We will be looking at this condition, primary systemic sclerosis. Okay, so primary systemic sclerosis is calcinosis cutis, renal phenomena, esophageal dysmotility, sick, sclerodermatitis, and telangiectasia. This is the condition which is known as Grace syndrome, calcinosis cutis, renal, esophageal, and systemic sclerosis and telangiectasia. So in this condition, patient in systemic sclerosis, patient has calcinosis, renal phenomena, whitish appearance, esophageal dysmotility, sclerosis, and telangiectasia. So, in this condition,